My name is Emily Moore, and our group is a part of the Functional Human Anatomy course in the Biology Department at Clemson University, fall 2021. Today, we will be discussing Dandy-Walker syndrome. Just to introduce this disease, Dandy-Walker syndrome is a rare genetic disorder that affects the brain during development. Typically, it affects the formation of the cerebellum during fetal development and also causes hydrocephalus. Symptoms can be noticed within the first year of infancy. Delayed motor development, swelling in the back of the head, as well as irritability or vomiting can all be symptoms. It is inferred to be caused by a mix of environmental factors as well as a rare genetic mutation. Exposure to teratogens and chromosomal abnormalities. It affects about 1 in 30,000 infants and is also more common in girls than boys. And for treatments, it can not reverse the symptoms, and surgeries can also be performed to reduce the hydrocephalus.
I'm Natalie, and I'll be talking about some of the anatomy behind Dandy-Walker syndrome. So like it was just said, it's a brain malformation that involves the cerebellum and the fluid-filled spaces around it called the ventricles, as you can see in this diagram up here. And the ventricles are typically filled with cerebrospinal fluid that is produced by the ependymal cells that line it. And this malformation is congenital, meaning it's present from birth and includes the enlargement of the fourth ventricle. And so this fourth ventricle is most inferior located and is posterior to the pons. And the cerebrospinal fluid made in this drains directly into the central canal and subarachnoid space of the cranial meninges via the two lateral apertures and the median aperture. In addition to the enlargement of the fourth ventricle, there's either a complete or partial absence of the cerebellum vermis, which is the area between the two cerebellar hemispheres. And then in children, when this occurs, this enlargement of the fourth ventricle, they might have an increased intracranial pressure, which leads to irritability and vomiting because this pressure might be like pushing on the autonomic reflex centers on the medulla oblongata, causing this vomiting. And then this picture right here shows two CT scans. The left is a normal CT scan, and the right shows the enlargement of the fourth ventricle. And then you can see the tiny cerebellum in that picture.
My name is Hannah, and today I'll be talking about the variants of the Dandy-Walker syndrome. So in this picture here, we have 3 different CT scans. The first is the Dandy-Walker malformation, and you can see how it has a small vermis and the posterior fossa. And the middle one is a cerebellar vermis hypoplasia, and you can see how the head and cranial cavity is also shaped differently. It has a normal posterior fossa though. And in the final left picture, or in the final right picture, the megacristerna magna has normal vermis and no rotation, but it also presents a big posterior fossa. So some of the symptoms of Dandy-Walker syndrome is it occurs early in infancy and mainly includes progressive enlargement of the skull due to excess cerebral spinal fluid surrounding the brain. The excessive cerebral spinal fluid creates increased intracranial pressure, which can also cause the child to have irritability and vomiting with this syndrome. So because the Dandy-Walker syndrome affects the cerebellum, patients may also experience unsteadiness, lack of muscle coordination, and jerky movement of the eye. But some other symptoms include abnormal breathing problems and issues with nerves. Here is a ultrasound of the Dandy-Walker variant. You can see it in the fetus within the patient. You can notice the absence of the cerebellum here. And towards the right, there are 2 pictures of, one is a sketch of a child with an excessive lump on the back of the head and the child who has a deformed cranial cavity.
Okay, I'm Jenna Millsap, and I'm going to be talking about some of the treatments. So an amniocentesis should be formed early on during pregnancy if it's detected, or if Dandy-Walker is detected. And then depending on the size of the fetus's head, vaginal delivery delivery should be attempted, but a cesarean section may be recommended. Surgical treatment is often used, and in that they drain the excess fluid to relieve the pressure and help the hydrocephalus. And then once the child is born, the main form of treatment is to treat associated problems on an as-needed basis. And then because of problems with unsteadiness and lack of coordination, physical and occupational therapies are also common treatments. Then some facts and further information, like Emily said earlier, it affects 1 out of 30,000 infants. Dandy Walker is a malformation that can be seen early in the pregnancy. Like we've talked about earlier, a visible connection between the fourth ventricle and the cisterna magna, and it kind of resembles a cleft. So some other complications of Dandy Walker can include the deformation of the central nervous system, alloplasia of the kidneys, liver, and pancreas, and an abnormal retina. Another interesting fact is that Dandy Walker is known to cause abnormalities, particularly in chromosomes 3, 9, 13, and 18. And then an abnormality in chromosome 18 can be associated with trisomy, which is an addition of a third chromosome in the 18th pair. And then this is our works cited.